The ceiling is so high in what we can do with data and artificial intelligence in healthcare. There is no one company that should be trying to crack this problem on their own, and just tiny data points.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. But I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say be solved if we have the will, the courage.
What got me to this place? Look, my entire career and passion in healthcare is around being an effective bridger. And so what I mean by that is my background's biomedical engineering. My entire career has been kind of in this product management, business translation space. And as I look back at my journey, when I think about early in my career, when I worked at Duke on, clinical trial translation, at Stanford on MRI development. What made me good in those jobs was not that I was the smartest in the technology. In fact, I was learning the math when I was trying to help with the physics around MR, right? But what made me effective was the ability to understand enough to translate to what it meant to a science community or to a customer base that wanted to grapple with that. Right, as I think about the work I did with health insurance exchanges. So early in my career, I had the opportunity to work across 7 or 8 state governments up and down the East Coast as they tried to respond to this small thing called the Affordable Care Act and what they needed to do to transition and set up state level health insurance exchanges. This was a bridger role that required the intersection of technology, policy, business, and let me tell you, becoming a Medicaid director doesn't happen because you're brilliant at running system integrator programs. And so I had the opportunity to work at a company that did that type of work. And the skill set that was needed, more than a deep expertise in any one function, was the ability to be deep enough to connect groups that didn't speak fluently to each other. At Doctor on Demand, similar. I worked there very early in their telemedicine journey. This is a company probably many of you are familiar with at this space, but way before telemedicine got the acceleration we've seen recently, helping them think through how do we shift from a solely B2B market strategy or B2C into B2B, right? The strategy when I joined was very much, let's get on a daytime television show. Let's try to get that one person to call in, as opposed to thinking about how do we go to employers? How do we go to payers? How do we go to self-insured businesses, et cetera? Similar at Apple, thinking about how do you position products in a broader ecosystem. And so I think for me, what my personal mission is in healthcare is to always be at the forefront of the technology that is most powerful in the day, but then to apply it back to solving healthcare problems that matter. And it's never going to be about the technology itself. And if you stay stagnant on one technology, you'll fall behind. And so, right now, in the last 5 years, the hype around AI has been tremendous. We'll have a chance to kind of unpack some of that over the course of this hour. Would love questions from you guys on that front. But when I think about my role at GE, my job is to harness this AI, not for the sake of the cool technology or the marketing slogan, but to harness it so it drives impacts that matters to our customers and their patients around the globe. Better efficiency, better quality, better outcomes. At the end of the day, that's what customers will buy. And those are the type of transformations that move healthcare forward, not in small ways, but in stepwise changes. And so AI is a tool. albeit a pretty powerful one. But at the end of the day, it's one tool in a broad arsenal for tackling the problems that matter in healthcare. So that's really what I meant when I said that is look, the sooner we get past how a product was built and the sooner we focus on what impact it has for a provider community or a patient community, we're going to start talking apples to apples and driving impact faster. So at the highest of levels, two big pillars of what I drive in the organization. Actually, let me first take a little step back. For those of you who don't know GE Healthcare that well, it's about a $18 billion healthcare business focused in the med tech space, with the big portfolios being about 9 to 10 billion in the big iron imaging, MR, X-ray, CT, about another 6 billion in ultrasound, so some of the smaller device, about another 1 to 2 billion in more of the software solutions, specializing again in kind of the radiology or cardiology oncology spaces that leverage images. So big healthcare company that's been around for a while. My job is very much a horizontal that cuts across all of those businesses. And the pillars that I'm accountable for and responsible for driving are, number one, how do we pick the right use cases across each of those P&Ls that best leverage, and specifically for us, it's often deep learning under artificial intelligence because of the imaging focus, but the organic use cases where if we can build a deep learning model appropriately embedded in the devices, it most differentiates from competition and provides the outcomes that our customers are looking for. An example on this organic pillar is what we've done with the critical care suite in X-ray, where the best practices but before AI was if you came into the emergency room, God forbid you were in a car crash, one of the first things that someone would do was they'd roll a mobile X-ray over to you. They'd take a scan of your chest region. That scan would go sit in a queue. Hopefully a radiologist would get to it within 30 minutes. Sometimes it'd be more like several hours. If you had a collapsed lung, that the window to intervene and do something about it was solely dependent on how fast a human worked through their inbox or work list. What we've done with AI is we've trained a model to spot those critical conditions, embedded that intelligence right in the device, and now those conditions and categories are prioritized in the work list. So you have critical first, not first in, first out. That's one example. We're driving that type of thinking across every single med device that GE Healthcare builds. So that's pillar number one, kind of this organic strategy. The inorganic strategy around partnerships is an exciting space as well in the AI world. Many of you will know these stats, but there's over $4 billion of investment flowing into healthcare startups, and specifically with medical imaging, which is where I spend a lot of time. There's over 200 startups with $1 billion of venture capital funding. Now, will all of those startups survive 5 years from now? No, there will be some attrition over time, but the strategy that I'm tasked to drive is how do we partner extremely well with this burgeoning ecosystem of innovation and help take back to our customers a single point of access for all of these different point solutions, and almost an invisible way of orchestrating across many different partners so they get one unified experience. So at the really broad level, what I'm accountable in my role is the organic AI strategy. How do we put the right deep learning solutions embedded deeply within our devices and products? But then driving our Edison's the name of our AI platform, Edison developer program, to work more and more efficiently with the developer community and provide better and better streamlined consolidation of that efficiency and innovation back to our customers so that they can work with one partner and not hundreds. I think it's pretty general across most areas of healthcare, but let me highlight a couple. So certainly within imaging, look, deep learning is tailor made for pattern recognition based on images. Some of the other areas around data. So think about monitoring, patient monitoring or EMR data. The standardization of that data has to be phase one before the AI can be applied, right? One of the beauties of imaging is there's such consistency in how the data is produced. In some other areas of healthcare, there needs to be a focused effort to standardize the data so that you can then apply the AI. I think, one of the trends that's been accelerated dramatically by COVID is virtualization. And I think of this in two pieces. One, clearly we all know that the data and trends around telemedicine. I think one of the recent stats I saw was that there was a projection that we'd be at what I think 20% of our clinical encounters in 2020 driven by telemedicine. I saw that same study projected 70% by 2023, which I don't think reflects reality, even as I see us beginning to see some trends back into the hospital. But we're never going back to the almost 0 to 5% of adoption in the telemedicine space that we saw pre-pandemic. So that absolutely is here to stay. And there's a lot that AI can do in this space. The other piece, the sub bullet around virtualization, is the expansion of the care team. And what I mean by that is, how do things like chatbots or extended care team begin to do some of the tasks that only providers and specifically MDs did before? And I think we're going to see this more and more. And with the aid of artificial intelligence empowering folks across the care team, we're going to see huge rises in this over the next 5 to 10 years. It really killed anything that was technology for technology's sake. There was zero ability of our customers to focus beyond products that help them be more efficient and drive higher quality. And now we're seeing a little of that return, especially in high-end academics, right? There's always going to be this fabulous research frontier that's trying to push the boundaries of science. But I really think COVID and look, in my AI world, brought in some ways back to the basics, right? And this is a little bit back to what I said at the beginning, and really where I'm trying to keep the team focused is, look, if this AI product, it doesn't matter how beautiful your sensitivity and specificity is, and the elaborate designs of the underlying network architecture of your data science, if it doesn't allow a clinician to be more efficient, if it doesn't allow a patient to have a better experience, if it doesn't raise the bar in quality, we're going to struggle to see adoption. And so I think that's a little bit of kind of some of the refinement of thinking coming out of COVID. Yeah, I think look, before diving in, and I usually think about three pillars for partnerships: the clinical, technical partners, and more of the startup ecosystem. But before even diving into kind of more of the mechanics of that, the ceiling is so high in what we can do with data and artificial intelligence in healthcare. There is no one company that should be trying to crack this problem on their own. And just tiny data points. Again, you guys live in this space, you'll know, but we've never been as good at a healthcare industry as creating data and as bad at using it, right? I mean, the stats that I see are anywhere between 2 to 4% of data gets used within healthcare to drive insights. The rest sits in some database, in deep storage, in silos separated from each other, and just doesn't get used to drive anything actionable in healthcare. So you've got this incredible backlog of data. And as we actually interview providers, 80% of them are willing to adopt AI embedded products, but only 10% have. So why? Why? We haven't yet, as technology innovators and product innovators, been able to kind of cross that bridge. And I think a lot of that gets underpinned by building the right type of partnerships. So clinical technology and kind of the startup ecosystem. Clinical, Logan, you laid it out well. It starts by, are you solving the right problem before you jump to the technology, right? Again, maybe this isn't what you expect to hear from the AI person, but the quicker I can get people to think AI as a how, not a what, the better. And so, we've invested deeply at GE Healthcare in these clinical partnership on the AI front for two big reasons. One, if you don't select the right use case, you mobilize a lot of brilliant people to build things that don't matter. Right. So how do we ensure that when we mobilize our data scientists, when we mobilize our engineers, when we mobilize our commercial armies, it's all around a product that matters to our customers. We've got to walk in the shoes of our clinical partners and really, really understand their workflows. So that's number one. Number two is around technical partners. This is a theme you'll probably hear from me kind of over this hour, but I think one of the most important things in healthcare moonshots is knowing what you're great at and understanding where you need to partner. And at GE Healthcare, we have been living deeply in technical workflows for decades, if not over a century, I think, with our X-ray products. And so we understand voice of customer and that last mile in the healthcare space of how do you deliver something. We are never going to or want to compete with someone like an Amazon in the pure basic data science toolkit that they're building out. So 4 years ago, we created a partnership with Amazon leveraging their SageMaker technologies, which are data science toolkits, and embedding that within our Edison platform for building AI, allowing us to focus on the data management and the data annotation capabilities that are healthcare and use case specific. Those pieces take an incredible amount of depth of knowledge in the healthcare space and an incredible amount of work, and partnering with the right technology folks allows you to move faster there. Similar partnerships with NVIDIA in the type of GPU work that they do better than anyone else, with Intel, with some of the CPU work that they have embedded across our medical devices. And so I think thinking in that partnership first, and where do I have a superpower and where do I need to partner with others to move faster is really pillar number two. And then pillar number three is around this incredibly fast growing, innovative ecosystem where we as GE need to move at the pace, not of GE, but GE plus others. And as we think about the Edison Developer Program that we've been running for over a year and a half now, we really think about carefully the voice of our customer, which the voice of our customer says, like, look, Karley, I want to tap into all this innovation, but I can't afford to have 35 separate contracts, 35 separate billing experiences, 35 separate cybersecurity checks, life cycle maintenance across all of these different solutions. Help centralize this for us. Sure. And for us, that means thinking about how we become better partners. And that's a big focus that we bring to life through our Edison Developer Program. Let me give a little bit of framing to even how we approach AI here at GE Healthcare. The grand majority of our organically developed use cases are what I call upstream versus downstream. And this is different than what we were talking about in the primary care space. But upstream meaning, how do you use AI to create the data faster, cheaper, potentially lower dose, those kind of things. So an example is an MR use case where using deep learning in the reconstruction phase, we were able to create images with higher quality at less time. You'll know this, right? That the age-old paradigm in MR has been time equals quality. And so what we're able to do is apply artificial intelligence into the imaging chain to create better data, faster data, cheaper data. When it comes to downstream and actually driving clinical decision making, we're really not playing in that space because we think it's going to be the ecosystem of deeply specific startups and innovators who go deep in a specific area who can solve those problems. And to be honest, what's going to happen first is everything you just talked about, which are much more about um, time savings, not clinical decision making. I mean, to the FDA's credit, they've held that bar really, really high on clinical decision making. And neither you or I want to see what happened in the CAD space happen again with radiology, where every breast imager I spoke to said, look, we use CAD because I get reimbursed higher. It doesn't actually help me do my job better, right? That would be the disaster in this space. And so I think our strategy is pretty well aligned with what you just said, because where we focus is AI to make data better. And what we're trying to set up in terms of the ecosystem approach is, again, to what you said, really investing in orchestration capability. So the ability to have a platform, tool, and structure, you can think roads and bridges, that sits across many, many, many different decision making, or not even decision making, but sometimes more operational focused AI downstream solutions, but tees them up in a way and delivers them in a way that's unified and more structured back to the radiologist, right? Because the other thing I hear constantly, and love your take on this too, is radiologists don't want 1,000 pop-up screens within their cockpit, right? You've already got 4 panels of screens that you're looking at between work list and comparing priors. And so part of what we're trying to do is kind of create a technology layer that aggregates across multiple different solutions, and then teeing it up for the final decision making to still be done by the clinician. I think we're very, very far away, if we will ever get there, from the clinician not having to be involved in that final decision making. I really see the next 10 years of AI and radiology being clinician plus AI. Now, hopefully AI makes things more efficient. Hopefully AI can do some of the manual quantification that isn't a good use of doctors' time. But the clinical decision support, that's not something that can or should move away from MDs anytime soon. Look, I'll start high level, and don't roll your eyes at me, folks, but if you don't have the right purpose and the right people, none of what I say after this matters. And that's not healthcare specific. That is any company I've ever worked in. If you can't articulate the why, talented people can go work anywhere. So give them a reason to choose what you're doing, and surround them with brilliant people who can challenge them, help them be better at what they're doing. And so look, if you don't have the people and the purpose, nothing else matters. But I do think there's 3 other ingredients when it comes to digital health that you've got to get right. First, and do you understand the product fit, right? Do people actually want this problem to be solved? But then just as importantly, will they pay for it to be solved? So the product fits and the commercial model. And I often see companies get one right and the other wrong, and then you stall out. But then the third piece that you have to think about from day one is regulatory, right? If you think about it in like a hierarchy of needs, like product, will anybody use it? Commercial and business model, will anyone pay for it? Regulatory, will it ever get to market, right? You have to have all 3 of those pieces together in the digital health space. And from pretty early, almost like the first 3 hires within your organization, if you want to get it right. Now, I think one thing I'd be amiss not to mention is this balance of healthcare domain versus outside in thinking. another thing essential to get right. And there is not a perfect formula. I think we've all watched tech first companies struggle to get into healthcare. But that doesn't mean you should have a team of only healthcare domain startups and experts without some people to challenge the, well, this is how we've always done it thinking. But you do need to get that balance right if you're going to be successful in digital health. This is one of those life questions you got to figure out, like how you get it right. But I guess for me, there are two things I thought of here. So one, again, why are you doing what you're doing? If you have the right why in place, you can weather a lot of storms. And then two, this concept of personal and professional board of directors. I think I'll speak personally in my own life. Resiliency really depends on the community you have around you and your ability to have people hold you accountable, but also trusted people where you can be vulnerable with things you're thinking about, challenges you're having, and you can trust that the advice that comes back is purely to help you improve. And I specifically say professional and personal because I think you kind of want to have those two groups if you want to set yourself up for resiliency in a space where it's hard to make the changes we all want to see in terms of driving some of these technology and step one changes in healthcare forward. Yeah, the clinical spaces where we focus most specifically radiology, cardiology, oncology, anything in that space, but then the broader trend of virtualization, we aren't going to do that on our own as a company that has for decades worked with providing devices to brick and mortar hospital settings. But virtualization is going to be, in my mind, the number one trend that flips healthcare on its head in the next decade. And there's sub trends there with moving to cloud and AI and interoperability. But I think the big trend of virtualization is an area where we are looking to partner to move faster than what we would ever do to build something on our own. In the very, very early, my organization now is about 250 people, 60 data scientists, 120 so engineers. So we have a lot of scale that we've built to over 4.5 years. But 4 years ago, it was 3 data scientists and 7 engineers. And we more or less, I mean, to be frank, ran reverse Shark Tanks within GE Healthcare around which use cases would drive the most movement for our customers and their patients and most movement in the market. And then we prioritized those first. And we got wins on the board that allowed us to scale what we were doing as an organization to then spread to that next level of use cases. And so, that's a little bit how we built the model at GE Healthcare in terms of, look, it's at a large matrixed organization, you've got to be able to prove that you can defend the core while you build the platform capabilities to move into one-step adjacent opportunities. And that was really how we set up the organization from the beginning at GE Healthcare.